Hello friends, welcome to the one-shot video of abortion focusing on Medical Termination of Pregnancy Amendment Act 2021. Myself Dr. Srinivasan, Professor of FMT from Chennai. Abortion, legally it is defined as the premature expulsion of products or conception from the uterus at any time, whether in the first or second or third trimester before the complete period of gestation. Conventionally, abortion means expulsion occurs in the first trimester, whereas miscarriage means occurring in the second trimester, that is between 13 to 28 weeks, whereas premature birth means after 28 weeks before full term is completed. Precisely, as per medical definition, it is a premature expulsion of fetus from the mother's womb before the age of viability, otherwise before 28 weeks. Viability means physical ability of the fetus to live outside the uterus. After viability, if the expulsion occurs, it is called a stillbirth. Coming to certain important terms pertaining to this topic, for the first 2 weeks after conception until implantation occurs, we call the product as the developing ovum or pre-embryo. After implantation occurs, which occurs usually by 3rd week, up to the end of 8th week or 2nd month, we call the product as the embryo. By 9th week, neck formation occurs in the embryo giving a human shape. So we call it as fetus from 9th week onwards till birth. The product of conception expelled, especially in the first trimester, we call it as abortus. Coming to classification of abortion, broadly classified into natural or spontaneous as well as artificial or induced. Natural further divided into isolated or recurrent. Recurrent means 2 or more spontaneous consecutive abortions occurring in a pregnant woman. Again, natural abortion further subdivided into threatened, inevitable, complete, incomplete, missed or septic abortions like that. Artificial or induced abortion further subdivided into justifiable and criminal abortion. Coming to natural or spontaneous abortion constitute 15% of all pregnancies, more common in the first trimester, especially 2 to 3 months. Causes. Most common cause is the genetic cause, constituting 50% of the cases, of which chromosomal abnormalities, under which autosomal trisomies, especially trisomy 16 is the most common chromosomal abnormality causing spontaneous abortion. Other factors include anatomic, endocrine, infections, immunological factors, and other reasons. Artificial induced abortion, which is deliberately induced, divided into justifiable or therapeutic. When the abortion is done under the purview of the legal provisions of MTP Act of 2021, then it is called justifiable or therapeutic abortion. Criminal or illegal abortion means when the abortion is done outside the provisions of MTP Act. Coming to abortionists, there are skilled abortionists who are nothing but RMPs with the necessary experience or specialization in the OBG. Then semi-skilled, they are having basic knowledge of anatomy, but they are not having the necessary experience or qualification to conduct MTP, called nurses, midwives, chemists, like that. Unskilled abortionists are those who are having rudimentary or no lack of knowledge of basic anatomy, and they don't have any training in that. They are quacks or untrained dice in the rural areas, like that. The MTP Act Amendment 2021 replaces the MTP Act of 1971, which played the crucial role for 5 decades. Under a newer amendment, the various indications and regulations have been provided. These indications, for convenience, we are grouping them under 4 headings, but actually they are given in different way that we will see later. Coming to indications, they are grouped under 4 headings, which can be remembered under SATE, that is S for social, E for eugenic, T for therapeutic, H for humanitarian grounds. Therapeutic indication means when the pregnancy itself endangers the life of the pregnant woman, or if it causes grave injury to her physical or mental health, then for well-being of the pregnant woman, MTP can be done. In case pregnant woman suffers from any serious cardiac diseases of grade 3 or grade 4, or any malignant hypertension, epilepsy or severe form of insanity, or any cervical breast carcinoma, like that. Coming to next ground, eugenic ground. That means if there is a substantial risk that if the child were born, it would suffer from such physical or mental abnormalities so as to be seriously handicapped. Suppose a pregnant woman exposed to teratogenic drugs like warfarin, thalidomide, or radiation exposure of more than 10 rats, or contracted any of the torch group of viral infections, especially in the first trimester, or if the fetus is a monster with anencephaly or phocomelia, or any Down or Turner syndrome like chromosomal abnormalities, etc. Or one or both parents are suffering from inheritable mental conditions like schizophrenia, chromosomal abnormalities like that. Coming to third ground, that is a social ground, when the pregnancy has resulted from failure of contraceptive method used by the woman or her partner. Whereas in the 1971 Act, the failure of contraceptive by the married pregnant woman or her husband alone allowed to abort. So in the newer amendment, unmarried woman also allowed to abort. Then second indication under social ground is the social or economic environment. Actual or reasonably expected may result in grave injury to mother's physical or mental health. Suppose extreme poverty is there, if there are already 2 or 3 children in the family, and due to economic constraints, upbringing of the unborn child may pose a severe financial burden to the family, then on the socio-economic ground MTP can be done. And lastly, the humanitarian ground, which means when the pregnancy is caused by the rape. Coming to MTP rules, consent is must for MTP. The pregnant woman is minor or a mentally ill woman, then you have to get the consent from the parent or guardian or caretaker. In case the woman is a major, then she can herself give consent. Consent means written informed consent should be obtained. In case of married woman, consent of the husband is not legally required. Even if he opposes also, with the consent of pregnant woman, it can be. Coming to experience for registered medical practitioners. Any RMPs registered before 1971 should have minimum 3 years of experience in the OB department where the recognized MTP center is there. Or RMP completed 6 months of house agency in the OB department, or had working experience of at least 1 year in the any recognized MTP center in the any hospital. Then RMP who has assisted at least 25 cases of MTP, out of which at least 5 cases of independent MTP should have been done by him or her. In that situation, with this experience of 25 cases or 5 cases of independent MTP, then that RMP can perform abortion only up to 12 weeks. Then new that class CA has been added, which says 3 months of working experience in the OBG in any recognized MTP center, or having done at least 10 cases of independent MTP. With this experience, RMP can perform only up to 9 weeks and using medical methods, that is drugs only, not any surgical intervention. Then any doctor with a diploma or PG degree in the OBG. Coming to what period pregnancy can be terminated. In the 1971 up to 12 weeks, opinion of single doctors regarding the applicability of the indication as mentioned in the MTP Act, MTP can be done. In the newer amendment, it has been enhanced to 20 weeks. In the 1971 Act, after 12 weeks up to 20 weeks, 2 doctors' opinion regarding the applicability of the indication is required. In this amendment, it has been increased to 20 to 24 weeks. But any of the 2 doctors can perform MTP, but they have to together sign the form which indicates the existence of the indications. Then, in this newer amendment, MTP is allowed more than 24 weeks, provided it has to be decided by the state level medical board comprising a gynecologist, pediatrician, radiologist or sonologist or any other member as specified by the state government. If the pregnancy exceeds 24 weeks, but only with the indication of there is a substantial fetal anomaly in that situation. Coming to actual indications, how it is mentioned in the MTP rules, we are expecting students to write these indications only instead of 4 grounds as we have seen in the start. Let us see what are the indications up to 12 weeks. That is, all the indications as we have seen therapeutic eugenic are mentioned here. Then beyond 20 weeks but up to 24 weeks, the pregnancy resulted due to rape or incest. Incest means sexual intercourse between the male and the female who are closely blood related. Otherwise, forbidden degree of relationship like between siblings like that. Then vulnerable group, which constitute minors and children, differently abled women, blind women, mentally ill women, including mentally retarded women, all are considered as vulnerable women. If they become pregnant, then MTP can be done. Change of marital status during the ongoing pregnancy. If the woman turns widowhood or she got divorced after becoming pregnant, then MTP can be done. Then eugenic ground. Then humanitarian settings or disaster or emergency situations, any pandemic or war situations as declared by the government, MTP can be done. Coming to indication for MTP beyond 24 weeks, here only one indication is provided, that is only if there is a substantial risk of fetal abnormality. So that if the child were born, it would suffer from physical or mental abnormalities so as to be seriously handicapped. Only on eugenic ground it can be done, but the decision to be taken by the state level medical board whether to allow MTP or not. Places where MTP can be performed. A hospital established or maintained by the government. Any government MTP center. Or in case of private clinic or hospital running the MTP center, they have to procure license from the district level committee with the chief medical officer or district health officer as its chairperson. The district level committee should consist of 3 to 5 members, including the chairperson. They will come and inspect the center for all the facilities available, then they will issue license. Similarly, for RMPs for performing abortion, they have to apply to the district level committee with the necessary experience certificate. Again, the RMP also have to procure license for performing MTP. In case if there is an emergency where the continuation of pregnancy poses the imminent danger to the life of the pregnant woman, then to save the life of the pregnant woman, any RMP without required experience, as we have seen, he can conduct abortion at any place which is not recognized, irrespective of duration of gestation, at any time of pregnancy. To save the life of the pregnant woman in an emergency situation, MTP can be done by any MBBS doctor like that. Then he won't be punished as per MTP rules. The doctor, especially the in charge of the hospital, has to maintain the register which contains basic details of the MTP done, like name and address of the woman, her consent form, indication for which MTP is done, what is the procedure adopted. That register should be maintained for at least 5 years from the date on which the MTP is done. Then doctor as well as hospital staffs have to maintain the professional secrecy. They should not reveal details of the pregnant woman who has undergone MTP to any person who are not authorized by the law. If they reveal these details to unauthorized persons, it is considered as contravening the professional secrecy, for which 1 year imprisonment, fine, or both will be given. The previous 1971 only fine of 1000 rupees is allowed. Here imprisonment also included here. As per MTP rules, there will be a rigorous imprisonment of 2 to 7 years in case any person terminating the pregnancy who is not a registered medical practitioner or without experience as mentioned in the MTP Act, or conducting MTP in a place which is not recognized by the district level committee like that. Not only the doctor who is doing MTP in the unrecognized place, the owner of the place also punishable with 2 to 7 years imprisonment here. So these are the differences between 1971 and its amendment. These are the various sections of IPC under which the criminal abortion will be punished. Let us see one by one. Section 312 IPC, whoever does the criminal abortion with the consent of the woman will be punished under this section. Not only the abortionist, suppose the woman herself performs abortion, seeing the YouTube video like that, she is punishable under this 312 section. Here, the abortion is done before quickening. Quickening means first perception of fetal movement by the pregnant woman, which occurs between 16 to 20 weeks. If the abortion is done before quickening, then imprisonment of 3 years or fine or both. After quickening, then 7 years plus fine. In this section, criminal abortion is done with the consent of the woman. 313 says the criminal abortion is done without the consent of the woman, irrespective of whether quickening occurred or not. Punishment is 10 years plus fine or life imprisonment, which means 14 years of imprisonment. As per 314 IPC, death of the pregnant woman has been resulted due to complications of criminal abortion. If the consent was obtained, then the punishment is 10 years plus fine. If the death occurred where prior consent was not obtained or against the will of the pregnant woman, then 10 years plus fine or up to life imprisonment will be provided. In the section 315 IPC, if the pregnancy is typically after 28 weeks, then the abortionist will be punished for conducting criminal abortion with imprisonment of 10 years or fine or both. Difference between 315 and the previous 312 to 314 IPC is there the period of gestation is within the limits of viability, that is before 28 weeks. Pregnancy exceeded 28 weeks, the abortionist will be punished under 315 IPC. Coming to 316 IPC, primary objective is to kill the mother, but death of the quick unborn child has resulted. She may or may not been harmed. In this situation, the abortionist will be punished with imprisonment of 10 years or fine. Coming to 511 IPC, if there is a failed attempt, criminal abortion has not been successful, even then the abortionist will be punished with half of the imprisonment as prescribed under section 312 to 316 for failed attempt. Coming to methods of inducing criminal abortion, the first month the abortionist will try some violence. It could be either direct violence or indirect violence methods, like the direct violence, receiving kicks or blows by the pregnant woman, or firm massage of the uterus through abdominal wall, or a cupping method. Indirect violence means carrying or lifting heavy weights, cycling over rough roads, jumping from a height, skipping, running upstairs and downstairs fastly. All these may or may not be successful in inducing abortion. Cupping means a lighted wick is placed over the lower abdominal hypogastrium, over which a metal mug is inverted, and the air inside gets heat and expanded and leaks through the mouth of the inverted mug. That cooled air inside will create a vacuum, which causes the mug to fit firmly on the abdominal wall. Now, if it is pulled upwards suddenly, what happens is it carries with it the abdominal wall, the anterior uterine wall, which causes the separation of placenta from the anterior uterine wall, leading to expulsion and abortion. This is called cupping, a method of direct violence, especially in the advanced period of gestation. Second is the abortifacient drugs, especially in the second month. They will try giving some drugs causing abortion. They are again directly acting on the uterus. There are certain drugs acting indirectly on the uterus, thereby causing expulsion. Coming to drugs directly acting on the uterus, ecbolics or immunogogs. Ecbolics means those drugs which promote the uterine contractions leading to expulsions. Most important drug is the ergot, synthetic estrogens, pituitary extract, strychnine, quinine, etc. These ecbolics are like oxytocin-like action, otherwise called oxytocics. Immunogogs are those drugs which causes the uterine congestion and causing severe bleeding and causing abortion. Examples include estrogen, borax, lamine, sanguinarine, like that. Drugs indirectly acting on the uterus, that is, they cause inflammation of other organs, thereby reflexively promoting the uterine contractions. GI irritants like tartar emetic, strong purgatives like castor oil, croton oil, magnesium sulfate, etc. They cause inflammation of GIT, which in turn causes the inflammation and the contraction of uterus. Genitourinary irritants, which causes the inflammation of genitourinary tract, like oil of tansy, turpentine, potassium permanganate crystals, which are inserted through vaginal route, cantharides, like that. Coming to systemic poisons, which are in the sublethal doses believed to cause the death of the fetus, leading to abortion. Commonly used are salts of inorganic heavy metals like lead, copper, antimony, mercury, like that. Or organic irritants like unripe fruit of papaya, pineapple, seeds of carrot, bark of lumbago rosea, allotropic juice. These are all considered as systemic poisons. Sometimes, in addition to poison, this abortion, it may cause the poisoning of the mother also. Coming to local methods which are employed in the advanced stage of 3rd to 4th month of gestation. Introduction of abortion paste into the uterus, like popularly fetex paste or uterus paste, like that, or lead paste. Introduction of abortion stick into the uterus, which causes the uterine contractions. Abortion stick means some 10-inch long thin bamboo stick. One end is wrapped with the cotton or wool, then which is dipped in the in irritant juice like a juice of marking nut or calotropis, and which is inserted into the uterus, causes inflammation, ulceration, and reflex uterine contractions and abortion. Then introduction of laminaria tent, otherwise called sea tangle tent or slippery embark, inserted into the cervix. These absorbs the moisture from the cervix, which swells up, which in turn causes the dilatation of the cervix, leading to abortion. Laminaria tent is a type of marine plant called Laminaria digitata. Then curettage, rupture of membranes by introducing metal rods and knitting needle, hairpins, like those objects. Then Higginson's syringe or enema syringe, forceful instillation of fluid into the uterus, leading to separation of placenta and abortion. Then aspiration using the syringe producing vacuum by means of suction inside the uterus. Air's insufflation into the uterus by means of syringe or pumps, which causes the separation of placenta. Complication is air embolism. Low voltage electricity, which may cause uterine contractions. That is, a negative pole is placed in the posterior cul-de-sac of vagina and a positive pole is placed over the lumbosacral region, and a low voltage DC current of 110 volt is passed, which causes the uterine contractions and expulsions. These are the medical methods of MTP in the ascending order, as in with the advanced stage of gestation. This can be employed like in the first trimester, second trimester, the advanced stage. Up to 9 weeks or 63 days, MTP can be done by giving drugs like that. That is a tablet of mifepristone 200 milligram followed by 4 tablets of misoprostol 200 microgram, if necessary 48 hours after giving mifepristone. This mifepristone is the antiprogesterone which weakens the lining of the uterus, thereby causing the detachment of embryo from the uterus. It is an antiprogesterone, whereas misoprostol is a prostaglandin analog which causes the uterine contractions, dilatation of cervix, and expulsion. Then dilatation and curettage. After obtaining the cervical dilatation by introducing laminaria tent or Hagar's dilator, then the contents of the uterus are scooped out by introducing a curette. Risk is perforation and a hemorrhage, leading to shock and death of the pregnant woman. Then introduction of cerviframe gel, a prostaglandin gel into the uterus or cervix, followed by oxytocin infusion. This causes the cervical ripening and dilatation. Oxytocin induces the uterine contractions and expulsion. Then vacuum aspiration abortion, which replaces now dilatation and curettage, as it is more safer. Here, after evacuate or a cannula is introduced into the uterus and a vacuum is produced by means of suction and the contents are expelled, which are collected in the jar like that, and whatever any remnants which are not yet come out after vacuum aspiration, they have to be curated out. This is called a vacuum aspiration abortion. The risk of perforation, which is more in a D and C, is lesser here. These are all methods generally adopted in the first trimester. Case of second trimester, where the fetus becomes bigger, then we have to adopt dilatation and evacuation procedure. Here, a clamp or a plier-like instrument is introduced into the uterus, and the body parts of the fetus are dismembered or mutilated. Spine is crushed, skull also crushed, and these individual mutilated parts are taken out. This process is called dilatation and evacuation. Then extraembryonic instillation of hypertonic saline. By means of amniocentesis, some 50 ml of amniotic fluid is taken out through periabdominally using syringe and replaced with the same amount of hypertonic saline, which is 3% of normal saline. The fetus consumes this and dies and got expelled. Otherwise, urea solution also can be used. Or intraembryonic instillation of prostaglandins E2 that will cause uterine contractions and expulsions. In the advanced stage of gestation, hysterectomy, which is similar to cesarean section, is adopted. These are the duties of doctor in a case of criminal abortion. When a woman with attempted criminal abortion comes for treatment to the doctor has to take the history of the circumstances, where it has been done, what method adopted, who has done that. If the woman is not interested in giving proper history, doctor should not force her. He has to focus on the treatment. Doctor better to get the second opinion from the specialist physician. Keep the police informed so that they have the knowledge of at least about the criminal abortionist. Treat her to the best of his abilities. Preserve all the evidence, like all soiled clothes, any foreign material collected from the genital tract which may show abortifacient drugs used, or abortion sticks, syringes, tweaks, etc. All have to be preserved and handed over to the police or sending to lab, which is used as evidence during the trial. Maintenance of proper day-to-day records like MTP and the professional secrecy also has to be maintained by the doctor regarding the details of the case. Then, dying declaration. If the woman turns critically ill, doctor has to arrange for dying declaration, preferably by magistrate, or in case of emergency, he himself record the dying declaration with the two uninterested witnesses. If the pregnant woman dies, sent to complication of criminal abortion, then death certificate should not be issued. Instead, the doctor has to inform the police so that they can arrange for autopsy, where the postmortem certificate will give the cause of death after all investigations have been done. These are the causes of death in criminal abortion. Immediate causes are due to air, amniotic fluid or fat embolisms, shock and hemorrhage due to perforation of uterus or other abdominal viscera, vagal inhibition due to sudden introduction of any instruments into the cervix or uterus without proper anesthesia or lubrication. Poisoning is rare, pertaining to immediate deaths. Delayed deaths which occur 2 to 3 days may be due to local infections, peritonitis, septicemia, pyemia, toxemia, like that. Remote deaths which occur several weeks later may be due to renal failure or jaundice, pulmonary embolism, bacterial endocarditis, sanitary infections like pneumonia, emphysema, meningitis, like that. These are the samples to be preserved in autopsy from the alleged criminal abortion case, like vaginal contents, pubic hair, blood, urine, stomach contents, blood from the IVC, any fluid from the uterine cavity, swabs of the uterine wall, tissues for histology from all organs. These are the differences between natural and criminal abortions. How to differentiate? In case of criminal abortions, generally they are taken by the unmarried woman or widow. In case of illicit intercourse, like that. Natural abortion, predisposing diseases may be the major cause. All the injuries, marks of violence, foreign bodies, fetal injuries, toxic effects of drugs, infections, they are all more common in case of criminal abortions, whereas these findings we may not find commonly in case of natural abortion. So for a detailed lecture on this topic, you can see the link given below in the description. If you find the video useful, you can refer to your friends also. Thank you.